Health officials are concerned the holidays could intensify the COVID surge driven by the highly contagious Omicron variant. While state leaders say there's no reason to panic, a doctor at one rural hospital says Kentucky can't afford another spike. He told LEX 18's Evelyn Schultz that's because they're already struggling to find beds. That's tonight's big story at 6.
It's just been a real stress to our system.
Earlier this month, an urgent plea from Dr. Corey Ryan at Wayne County Hospital in Monticello. As he tried to find beds for 4 critically ill people, he tweeted, "We have called every Kentucky hospital with the means to care for these patients, and there are no beds." Nearly 3 weeks later, Ryan says the situation hasn't improved.
We're calling 30 and 40 hospitals, and we're using referral hospitals we've never used in my 20 years. I mean, we send patients to Ohio and Tennessee, and just hospitals that we've never even thought about using.
As a critical access hospital with no ICU, Wayne County Hospital relies on bigger hospitals for some of their sickest patients. So when those facilities run out of beds or don't have enough employees, small rural hospitals also pay the price.
And now we're housing critical patients in our ER. Last night we had, we're holding, as of last night, a ventilated patient and a patient that's had a heart attack that we just can't get anywhere.
Federal data shows across Kentucky, an average of 90% of ICU beds are currently occupied. Nationwide, that number is 79%. And earlier this month, Governor Andy Beshear announced the state's nursing shortage prompted him to declare a state of emergency. Dr. Ryan says a handful of his own nursing staff also quit this year, citing burnout or vaccine mandates. So he's fearful an Omicron surge could stress the hospital even further.
We still don't know what's to come, and that's the scary part.
But he still has hope the situation will improve as the pandemic enters its 3rd year.
I think every hospital in the state of Kentucky is doing the best they can. It's just a problem we need to try to face and fix for sure.